Hi, everybody. This is Dr. Kogan, Misha Kogan, Medical Director of GW Center for Integrative Medicine. Thank you so much for joining our open house today. We have a pretty busy program. We will have providers joining us over time, not everybody at the same time, I hope. First, what we'll do is I'll give the medical director update for about maybe 5 to 7 minutes. And then I'll hand it over to Cynthia to talk about Mbsr and Nina to also talk about Mbsr, but also
Mbsr, I want to do that.
Mbsr, mindfulness-based stress reduction program. We'll get there. So director's update real quick. As you may have heard or seen by email, our practice have grown tremendously in the past 12 months or so. We have added a second physician who's going to do a primary care and a concierge practice with me, since there's a very large interest in more individualized time with us. And so we started that. We already have about 10 patients in the concierge program. We're planning on growing it to about 30 patients max, because we don't want our practice to become concierge practice. We're simply doing this because there are a few of our own long-term patients who've been asking me about this for years. And since Dr. DeMacher joined, I felt like now we have capacity to co-cover when one of us is away, so that there's a constant continuity. Dr. DeMacher was running a very large branch of Veterans Affairs Hospital with something called war-related serious injury program, which is like basically a Mayo Clinic of VA. She's ran that for over 10 years. And before that, she worked with Andrew Weil and ran her own practice for about 15 years. So she's much more experienced than me. So I'm very happy about that. Finally, somebody in the clinic with a lot more experience. That's good. Not that everybody have a lot of experience in our clinic, but so we're quite blessed that Sharon joined us. She will be doing mostly family medicine, so kind of a general practice. She's not very heavily trained in functional medicines, which is fine because that's my kind of a much more of what I do, but she's trained in just a straight integrative medicine and family medicine, of course. So that's one big update. Another update where you'll hear from Cynthia and Nina about classes, Mbsr classes, but we're planning in the next 6 months to run at least 2 other classes. We're planning to start Alexander Technique, which is a body positional adjustment class. It's a class that can be done partially on Zoom, but it will definitely be in person. We have a pretty advanced expert who we're going to fly from Boston. She's a director of the program there, and we used to have our own Alexander practitioner here, but we felt that we want to have somebody with a bit more experience and who's dedicating her time just to the Alexander. So we'll have Anna fly from Boston a couple times a year for the weekend class, but then she's also going to hold periodic classes online. We're also starting a breast cancer class in a few months. That's with sponsorship by the GW Breast Cancer Center. It's a Dr. Thiel's program. So those are some of the updates for the classes. Updates on general operations of the clinic.
Been living on.
We have, in addition,
for a number of years in an independent
everybody
care
please
community.
mute yourself.
Now you're muted. Misha, you're muted.
Thank you. We have recently added golden words of Zoom, right? You're muted. We have added a nurse practitioner who's actually going to do home visits, because we felt that we have a lot of patients who don't want to come to the clinic, and they also have a hard time doing Zoom consults. So Odna, we just added her a couple of weeks ago. So she's going to do exclusively home visits, and also her and Mary Kendall also came back to us. They're going to also do home infusions if needed for people who are acutely sick. So those are in the new line of services. We're also quite blessed. We have Ashley, who is our co-partner from GW Wellness Center, who's going to start running long COVID programs. So we see a lot of long COVID patients in the clinic, over 100 at this point, but we have not been formally organized about this, and we haven't kind of standardized our protocols. So we're hiring, she actually already joined, Ashley, to kind of manage that part. So that part you'll hear more. What I will do in the upcoming months, I'll have a half-an-hour interview with Ashley to discuss this, to sort of have her present the program and describe the logistics and how it's going to be run. We're actually very hopeful to get a very large grant from NIH to do this at no cost to patients, but stay tuned, because that's not really clear how that will work between GW, which currently has the long-term COVID clinic. And so we're trying to figure out what parts, how it's going to fit. So that's that. Those of you who are interested in our memory program, something called Recode, we are going to apply for the Center of Excellence with Bredesen, and we're also publishing our data in the upcoming months. So we finally gotten to students to organize fully data and try to get this out to published. So I'm not going to give you a preview yet, because we haven't done the math. Our preliminary math, we have about 50% of patients doing extremely well. What that means is that they either not progressing at all, so they just, or they completely, partially or completely reverse their Alzheimer's disease. It's not as good as what Bredesen data shows, which is up to 80% improvement. But we're speculating that this is because our patients generally a lot older and a lot more complex. So they have a lot more comorbidities and other medical problems. So that's that. Let me think what else I really wanted to discuss. Now we added Ayurveda. Super excited about that. Dr. Jennifer Rioux hopefully will join us. I don't know if she's here. If she is, Cynthia or Nina, check if, by the way, if you guys see any other providers, just spotlight them and co-host them so that we know. If she's not making it, please, I have posted on the Facebook my video with her that I did this Wednesday. So it's a half-an-hour explanation about what is Ayurveda, what is Ayurveda good for. So please, by all means, check it out. If you have not subscribed to YouTube channel yet, and you like YouTube, that is an assumption that you like something. But if you do, please, by all means, during the conversation back and forth, I'll post all these things in the chat. But the Facebook, advantage of Facebook, if you own it and why you want to follow, we have a group for Center and we also have a page for Center, both. Group is more for, well, both of them, they have slightly different functions. I think the one, it's easier to kind of follow updates. The other one, you can participate in back and forth discussion. So I decided to run both. But Facebook is advantage is that it's a kind of a parallel. If you miss the email that we're going to keep sending the way we are sending them, just in case, then you can have access to the updates and events. We will try to run open house like this at least every 3 months. We'll see. If you guys really like it, we may want to run it even more frequent, because I see we have a pretty good showing today. So that's my 10 minutes. I think I'm gonna stop. I probably forgot something. I'm sure I have. Let me give you my personal update, since I'm gonna probably after that quite shut up and only answer questions. So my personal update, I have gave up several teaching positions. I'm also actually resigning from AIM Health Institute as executive director. And I'm just going on a board as a regular board member, and we are getting somebody else to manage day-to-day operations of AIM. And part of that is that I'm actually going to concentrate on the CIM clinical part, but I also was asked by my spiritual teacher to lead our healing concentration. And because of that, I felt I need personal time. And for 3 years, he's also become will become much more of my personal guide. So it's also going to be my personal time to explore and learn deeper. And hopefully that'll somehow improve my clinical skills and make me a better doctor. So with that, I'll pass it on. Cynthia and Nina, you guys go in whatever. Maybe let's do Mbsr first. And then we'll do the EFT.
Thank you, Dr. Kogan, and hello, everyone. Delighted to be here with you. I am a mindfulness-based stress reduction qualified teacher, as well as integrative wellness coach. And I just want to give you a very brief overview of Mbsr. And of course, Nina Powel is here. She's going to provide information as well of her background. But if you're not familiar with mindfulness-based stress reduction, also known as Mbsr, it is an 8-week evidence-based program that offers secular, intensive mindfulness training to assist people with stress, anxiety, depression, and pain. And I just would like to share my screen for a moment. So again, Mbsr is an instructor-led program where you're guided in practice to use to manage stress more effectively in order to enhance healing, vitality, and joy. And it is meditation and yoga practices and very supportive community, allowing you to modify behaviors, hopefully better manage stress as well as chronic pain. Again, it's an 8-week workshop. Participants meet 2.5 hours a week with one all-day session. And as you can see, sessions include guided activities, teacher-led instruction in the practices, exercise to improve awareness, interactive learning, group dialogue, and mindful communication, as well as daily assignments. So the next session, Nina and I just completed a Spring 1 session. We co-taught, a wonderful group, wonderful experience. The next session begins May 7th, which is next Saturday. There's an orientation that is free this coming Monday, May the 2nd at 6:30 p.m. You do not need to attend the orientation to participate in the Mbsr course. However, we certainly encourage you to. It's an opportunity to ask questions and meet other prospective participants. The class will run again May 7th through June 25th, Saturday mornings, 9 to 11:30 a.m., with the retreat on June 12th from 9 to 3 p.m. All the sessions are held online through Zoom, and you can register by going onto the GWCIM website, www.gwcim.com. If you have any questions with or any challenges with registration, feel free to reach out to Monica Arias. You can see her email address on the screen. And if you have any questions about the upcoming program, of course, feel free to contact me. And I also wanted to show briefly, again, this is the information for the Spring 2 session with the orientation, the class, the retreat, and my contact information. The first fall session will be taught by Nina Powel. There's her contact information that begins on Wednesday, September 28th from 6:30 to 9 p.m. And with that, I'm certainly open to any questions, and I can also turn it over to Nina Powel.
So I'm monitoring the chat. I don't see any questions. I'm going to give people a second. Maybe if somebody wants to say something, they don't want to type it, by all means, unmute yourself and ask the question. If not, we'll move to have Nina talk about EFT.
Thank you. Thank you, Cynthia, for giving that wonderful introduction on Mbsr. Are you hearing me okay, or did I freeze? Okay. Thank you, Cynthia, and thank you for mentioning. So Cynthia is teaching the course coming up in May, and I'll be teaching the Mbsr course coming up in September on Wednesday evenings. So just to shift from the Mbsr conversation, I also work as a mindfulness and EFT coach through GWCIM. And I want to talk a little bit about EFT and what it is and how it's helpful. I'm going to share my screen here. So EFT is a mind-body practice that you can use to regulate emotions and get your nervous system back to equilibrium. The main objective of EFT, which is also known as tapping, so it's more popularly known as tapping, I'm going to call it tapping. The main objective is to reduce the intensity of difficult emotions. So if something is really overwhelming going on in your life, it's got you really worried and stressed, you can't get it out of your mind, tapping more quickly can reduce the intensity of the negative emotions and calm down that fight-flight response, activate the relaxation response, so your body can get back into a state of equilibrium and you can think more clearly about it. It's an evidence-based practice. Many studies are ongoing. Some of the key studies show that it decreases arousal in the amygdala, which is our threat detector in our brain, which the part of our brain that triggers that fight-flight response. And it also shows, studies are also showing that it reduces cortisol, the stress hormone in our bodies. So there's many more studies available through Johns Hopkins and NIH, and I can certainly send people the links to that if they're interested. It's also well researched in the veteran population. It's showing that it's effective for trauma and PTSD, and it's also effective for major and minor stresses of everyday life. It's also effective for phobias, and as far as the stressors of everyday life, things like test anxiety that students may have, phobias like going over a bridge, anything that's intense and overwhelming, makes you feel stuck. Also, I have people coming to EFT who are having symptoms from long COVID or other health conditions that causes their nervous system to be more chronically dysregulated. So it's hard to do meditation, to do an 8-week Mbsr class, or to sit down and, get quiet and meditate and turn attention inward, that in fact can be triggering. So EFT also can work for that. I've been teaching EFT for many years to college students, and they find it effective in reducing their stress around anxiety, depression, and academic pressures. So how do you do tapping? It's considered a mind-body practice. So it's falls under the umbrella of energy medicine, like acupuncture. So basically, you think about a stress or a problem you're having, you rate how intense the stress is, the emotional level, and then you start tapping. You start tapping on the 9 meridian points, acupuncture points, while you're talking about the problem, venting about it. You could be talking out loud or silently to yourself with the practitioner, and feeling those stressful emotions. And so you do a few rounds of this. So basically what you're activating is this quality of acceptance towards your feelings. You're bringing in positive statements as well. And then you close out the tapping process with some affirming statements. And then you check in. You think about the stressor, the problem, the overwhelming feelings. Did your level of intensity go down? And if it didn't, you would do more rounds of tapping. And if it did, you'll find that you can think about that same problem and actually feel less emotionally charged, feel more centered and stable as you think about it. And you can think clearly about it. So that's a very quick and simple explanation of tapping. If anybody, has any questions, please let me know. I can demonstrate on Misha. I'm just kidding. But yeah, so that's just a very quick.
Well, we'll again, one of the sort of shifts in how we're gonna interact with our own patients going forward is, in the next weeks and months, Nina and I will do the actual video, and I hope that we will figure out how to actually do a little demo of EFT on the video. We'll have to talk about this. This whole Zoom thing with the pandemic, you have to learn how to be creative. So we'll.
No, we can absolutely do that. And there's also many videos out there.
I think that we can use those, but I feel like we should do our own, because I think the whole point here is we're creating a small community, and we want to make sure that people can see how it will be done directly to them, not necessarily how somebody else is doing somewhere else, which may or may not be relevant.
Absolutely.
That's great. All right. Do you anybody have any questions for Nina? Nina, do you want to add anything else to what you were saying?
Yeah, as Misha said, we'll have a demo upcoming. If you want to try out EFT with me, I can offer a short, free session. Feel free to contact me. I'd be more than happy to do that. And Cynthia, you've tried out EFT with me, so I don't know if you want to mention anything about it. But that's all I have to add.
Does the EFT falls? Like, can it be done in a group, or it's really very individual and cannot be done in a group?
It can absolutely be done in a group.
Well, so maybe we'll do a little actually group demo, and instead of you and I talking, we'll just record that. If any of our patients are comfortable with being models on YouTube. So we'll get that organized in upcoming months. I think that's a good idea.
The other thing I want to say with tapping, and even if I did it, with you individually or with the group, is you don't necessarily have to talk about your problem or what you're thinking about out loud. So you could just be internally thinking about the problem that's stressful for you, the feelings coming up while I'm guiding the group or an individual through tapping. So it can remain a very private a process as well.
So there are several questions there. Let's do EFT questions first. Well, Lisa, thanks so much for your comment about EFT being a powerful tool. Geraldine sent me a personal question about, will there be a group class for learning EFT? So maybe we'll do a little demo, and then if there is an interest, we'll do an actual class. So. And then Cynthia, and both of you, Nina and Cynthia, there is a question about schedule for the September Mbsr class. Do we have dates set up already, or is it still stay tuned exact timing?
No, I have the dates. So it's going to start on September 28th, and it's going to run for 8 Wednesdays, and it's Wednesday evening from 6:30 to 9 p.m.
And then there will be a fall 2 session likely, and that will be held on the weekend. And those dates are pending. They'll be coming very soon.
Very good. And just if somehow you forget, we are trying to keep up with the website. There's still some updates that we're a little behind always, but at least for the spring dates are all in there. And so when it gets closer to maybe sometime midsummer, we'll definitely post all the dates on the website so that it's also easy to find. So,
I just want to say that I've experienced EFT with Nina, and I highly recommend it.
Oh, thank you. Thank you.
Well, Tiffany is here and Angela is here, so I'm actually going to have Angela go next because we have a party at our house, and also we have a whole bunch of kids, and she's gratefully allowing me to just be with everybody and not worry about what's going on, but I am hearing what's going on down there. So I'm going to add her on the spotlight. So Gel, well, talk maybe for a couple of minutes about your acupuncture practice, but I think people would be more interested in learning about your added new certification, both on biofeedback, but also particularly on somatic experiencing, which is you're becoming an expert in that.
Something that I just started practicing. Don't really.
Well, no. So correction. Angela's been practicing acupuncture same 15 years that I have been, right, or more. But Are we talking about somatic experience?
Somatic
Yeah.
experience. Yeah. So I've been practicing. Can you hear me? Okay.
It's a little choppy, and maybe volume needs to be a little up.
I don't know how to put the volume up.
Just get closer to the screen.
I am trying.
That's better.
How about that?
It's okay.
Oh,
That's our parrot. We're housing a parrot for.
so he's trying to bite me.
Yeah,
And the dog is trying to catch him.
his name is Kinky Pooh, so he's
Okay.
behaving very kinky.
He needs
It's
EFT.
very
Okay,
entertaining.
maybe I should talk about animal therapy for a
Yeah,
moment.
there we go.
Which
Thank you,
would be
Seva.
also awesome. Okay, thanks, Seva. Okay, so I've been practicing acupuncture since 2005, I think. And it's more than 10 years at GW, Center of Integrative Medicine. I'm practicing Japanese mostly style of acupuncture, kind of mixed with
Jay,
traditional
people
Chinese
still
medicine.
asking you to speak louder. They're having a hard
I
time
don't think I
hearing.
can do anything. I'm actually as loud as I. Let me just do it without the speakers. Is it any better?
No, not really.
Okay.
But okay, so let's just do what we can. It is what it is.
Yeah, I see all the comments in the chat. How about if you just let Tiffany talk about acupuncture and Chinese medicine, and you can say a couple.
Well, just say a couple of words, and then we'll pass it on to Tiffany.
I have my volume up at level 10 on my computer. I can hear you fine,
Okay.
Angela.
Okay, so having practiced acupuncture for a number of years, I got interested in how I can use my acupuncture work and body work. I think acupuncture, Chinese medicine is energy work, what we usually say, but also it's a body work because we have a lot of hands-on methods and techniques in Chinese medicine. So I got interested in how I can use it in helping people to address their trauma. And when I say trauma, it can be anything. It can be a big traumatic event, or it can be cumulative life, kind of long experience of not feeling safe, not having maybe safe childhood, and then not kind of fully feeling your human potential, so to speak. So it's kind of like also has this direction maybe towards some connection with spirituality and meaning of life. So somewhere in the middle of that, so I decided to take a course on somatic experiencing. That was about 4 years ago. So I finally finished, a little bit slower because of the pandemic, but also pretty much certified. Gonna be in a couple of months when I just submit all the papers, but I'm done with the training, and I started incorporating this training into my acupuncture practice pretty much from the beginning, because it did affected me personally quite a lot, like since the very first practices that we did in somatic experiencing. So to describe it really in a simple words, and I don't have much time right now, it's taking focus on autonomic nervous system and helping clients to learn how to self-regulate. A lot of things actually kind of around here are addressing this, because it has become apparent that it's very important. All the mindfulness practices, as well, you know, even Mbsr, as we talked, you guys just heard about Mbsr. Basically, like all healing is one of the ways how we can understand how healing is happening, is helping to regulate our nervous system, and from there our especially autonomic nervous system, vagus nerve, because from there it's how the whole body is like working under orchestration of that nervous system in hormonal homeostasis, immune system, everything basically. So somatic experiencing is using a body awareness, So we track body sensations. So let's say we talk about emotions, we talk about during the session about maybe even the events, but the focus is not so much on the content, on remembering what exactly happened, but on what's the effect right now in the body. So we bring it up, get in touch with that, and the practitioner, like me, in this process is creating this kind of a mirroring effect, a safe space, and also like just a feedback system, helping to recognize, helping to track sensations in the body, not to interpret them, but just kind of bring them to awareness, to the surface. And then the process, like the body really knows what to do. Honestly saying, we're wired to go in the direction of self-regulation, self-healing. That's what we want to do, but we get stuck. Some like a trauma especially affects the system, so in a way that we have this unprocessed, unfinished, incomplete responses of nervous system. And that's what we're trying with somatic experiencing. We're trying to kind of get closer to those um, blocks, maybe I would say, in the body, and kind of help to bring them to surface and get them completed and kind of finished. Again, it's not so much about the story in this case. So body, when it recognizes that there is some memory that got stuck, and so for example, you wanted to, there was an event like an injury, and you wanted to protect yourself, your body wanted to protect yourself, your autonomic nervous system wanted to protect itself, but it failed because, you know, the circumstances were either too quick, it was maybe accident. So body feels like it failed, but body didn't fail. Body did the best, its best. So if we focus on the sensations in the body that are still there about that event, the body have a chance to actually finish, to like complete certain movements. And sometimes it just goes like that, like it was the protective movement in the body, and something abrupt happened, and trauma happened, an injury. We still can go back to that movement. It's in the body, it's in the memory, it's in the physical body memory, and how the body to complete and discharge. Maybe there is like kind of shaking, kind of and then all of a sudden something feels complete, and the healing just begins to happen. So, and we can move forward. And it can be about physical trauma. Sometimes people have repetitive physical traumas because of these issues, or in most complex cases, it could be something even like pre-verbal. And it's so a lot of therapists study somatic experiencing as well as body workers, and it's kind of two kind of sides of the same process. So I usually, when I work with the clients trying to use my somatic experiencing skills, I ask if they have a therapist, because the content also needs to be addressed, especially if it's a long-term trauma. So I don't know if you guys have any questions.
Great. Thank you, Angela, so much. Yeah, so let's see if anybody, so far I don't see anything in the chat.
For me, within one session, I do acupuncture, body work, and somatic experience approach, and I just go. It could be one more predominant in the session, depending on the needs of client, or maybe we go more with the somatic experiencing path. So
Can I ask you a question? So can SE, as we sometimes say, short, can SE be done on Zoom, or it must be done face to face?
So we just discovered during pandemic that it can be done on Zoom. Mm-hmm. So of course the real touch is very important, and if there is an opportunity to use that.
Mm-hmm. So maybe it can work as a combination, that partially
yes, definitely can work as a combination, and definitely if there is no access to in-person sessions on Zoom could be very helpful.
Mm-hmm. Okay, great. And Lisa is asking, is it like clarifying, is it a chat therapy? And so she's saying not following how process works.
So there's a bit of a discussion. This is not a chat therapy. This is not psychotherapy. It can be. It's there is a communication between practitioner and the client,
Mhm.
but the because we need feedback. But things do happen on a different level. So things happen on a somatic level, but because we want to bring it to consciousness, we bring it into the language.
So it's like Nina's put that's body-based. I'm adding, it's more of a body awareness practice. It's not like a massage or acupuncture. It's awareness of processes inside the body, correct?
Well, yes, plus I can help that body awareness and energy movement using my hands, like not really massaging, but more like just
Hmm.
placing hands. Okay, so
Jenny Lemon puts a really good idea. She's saying, could I call it SE informed acupuncture? I think it's a great idea.
perfect. So do you guys remember how we like not even that long ago we realized that the babies cannot thrive without touch, right? So
Mhm.
there's touch is a communication. So SE definitely not a chat therapy, but it's not purely only touch therapy like Reiki or massage. It's somewhere in between. Um, so if the baby cannot thrive without touch, right? Appropriate, proper, you know, support. We use touch as a support for the healing.
Okay, sounds like we'll need a demo. We'll need to do a demo because there's still a lot of questions and we need to move on.
So,
Yeah.
so
Nina had a hand.
Well, I was just going to say, I had this exact treatment from Angela. So if we have a minute, I can just explain how it worked. I had fell and hurt my back, and I was already seeing Angela for acupuncture. And then she started to, work on my back. And in addition to doing needles and massage in the area that was injured, she brought in the somatic experience by asking me to remember when it happened, where I was, like kind of like frame by frame, think back to when it occurred. What were you doing? How did it happen? What were your thoughts and your feelings that were coming up after it happened, before and during? And so I got a chance to kind of go back and, revisit it in my mind and talk about it. And then by the time we were done examining it that way through my thoughts and feelings and talking about it, I felt like I had reframed it and felt more empowered as I thought about the fall and the injury. Whereas previous to treatment, I thought about it in a way that did not make me feel empowered when I thought about that fall. Made me feel more worried about falling again or the health of my bones, et cetera. But after going through the process with Angela, where she added the somatic experiencing piece, I could think about the fall and actually feel not, emotionally reactive about it. In fact, I still think about it and it feels like not that big of a deal. And that I healed, so it doesn't make me feel weak for having that fall. So I don't know if that's helpful, but I thought that it was an amazing experience when you brought it.
I think that we're gonna have to do a demo. I think I agree with Lisa, who keeps trying to ask clarifying question. I think it's not something that popular and it's just not well understood. I think if we're able to show what it looks like, it'll be a lot better capacity to grasp.
Can I add a couple of words? I actually just finished my last part of the training was more about touch. So it's not right like Reiki. It's more like therapeutic touch, if you ever heard of it. It's placing my hands, but I don't manipulate. It feels more like craniosacral type of work. So it's mostly holding, but in a direct contact, not like Reiki. Like Reiki could be direct or above the body. So, and I'm not trying to manipulate, but sometimes I can use a little bit more pressure or less pressure, but this is touch based on biofeedback. So I'm not really doing anything. I'm not manipulating. I'm lending my hands for the person on the table or on a chair to feel an extra support, an extra support to go through what they're going through the body, through the certain process of their nervous system. And it's like, just imagine, like, you have your child talking about a certain experience. What do you want to do? You want to like place your hand on the shoulder or something like that, and it makes it easier. So in that kind of way, support. So we were placing our hands directly on the joints because energy gets kind of stuck in the joints. That's great for pain, but also like hands in the back of the head where cranial nerves are kind of like the muscles. If they're relaxed there, it's just regulates nervous system. And there are exercises too. It's not just talk and
Well, I
touch.
want to be mindful of time, Jed. We still have Tiffany and
Sure. Just let me finish here.
Jennifer to go.
I'm glad to
And we have a lot of questions coming in. So.
Okay.
So no, I'm realizing I think we're really gonna need to do a full demo with you. And what I will do is we'll do an actual recording, not the way I usually do it on Zoom, but we'll do it in the space, in the clinic. Maybe somebody can volunteer, one of our practitioners can volunteer to be a patient, and then we'll do an actual Jennifer. Okay, so as I mentioned, we have like other things going on in the house, so Angela may need to leave in a minute or two, but if anybody else have a kind of a last question, maybe Angela, you can answer it by chat instead of, so that we can move on and have Tiffany talk a little bit about her practice. Tiffany has been seeing a lot of post-COVID patients, and we felt like it would be important for her to say a few words. Tiff, your visual is off, just FYI. There we go. And now you're muted.
Hi. You want me to talk about post-COVID?
Yeah, well, post-COVID and whatever else is on your mind in terms of you kind of, and I keep forgetting to say Dr. Hoyt, because Tiffany is actually a doctor of Oriental medicine. Angela and Deidre are, they have masters in acupuncture, and Tiffany has a PhD in acupuncture.
Thank you, I appreciate that. One thing that I forget to talk about is that acupuncture, when it's practiced at its full extent, works on the body, the mind, and the spirit. And I very often forget to go into the particulars about that. There's a very simple point that if someone has most kind of shoulder pain, I can needle that point with precision. And there's a technique called Dao Yin, which is leading the energy to that point. And you have someone move that shoulder and you can get relief almost immediately. That's on the body level. On the mental, emotional level, what Angela was talking about is sometimes cognitive therapy is just too much. When you have someone who's really smart, they can talk their way around anything. They can talk about anything without having physical change in their body. But sometimes when you just really encounter the place where a trauma is lodged in the body, you can move it. You can move it gently and sometimes a little less gently, just by addressing it in the tissues. And that's on a mental level. But yesterday, was it yesterday or it was 2 days ago, we talked about someone with grief whose life changed, altered course because of the loss of his son. And grief is, as Dr. Rioux said, it can become a spiritual blockage. And at that point, you can't talk it out. You can't talk someone out of grief. You can only work with the grief, see where it's lodged in the body, and hopefully move it out and move it, get it unstuck, dislodge it, let it separate from the tissues where it has been encapsulated. And in some ways, we often talk about in Chinese medicine, we talk about tumors as an emotion that has been surrounded by tissue and then has become solid. So that's what I don't often talk about, the 3 layers that we treat with acupuncture, but I think that's a great example of working with the fascia, working with tensegrity, and then finally finding, solid emotions that have been lodged in the body. Just a quick thought about COVID. What I found with COVID patients is that they're exhausted. And we just do a lot of moxibustion. I don't often talk about moxibustion. Moxibustion is Artemisia vulgaris. Common mugwort grows on 6 continents in the world. It's used in every traditional medicine. It has a little light floss underneath its leaf. The floss is picked, it's carded, it's dried, it's rolled into very small cones, placed on acupuncture points, and then lit on fire, and you remove it before you get to the skin. In Asia, they will scar the skin to continue to treat the body. In the United States and in most Western countries, you can't do that. And I wouldn't want to do that. And the energy and the aromatics and the monoterpenes enter the body and make a direct beeline into that area. And it seems to expand into the channel, and it works like vitamins. And so with my COVID patients, the first thing I do is a lot of moxa. Moxa their kidneys so they have more energy. I moxa their bladder so that they don't sweat. I moxa their liver so that their liver doesn't have to be so tense and can relax. And I moxa their spleen so that they can start absorbing food and nutrients much with more efficacy. And then there are a variety of different symptoms. There's the sinuses, and there's a ton of wonderful sinus points up here and here and here that I've used on a lot of these patients, and they get immediate drainage, and sometimes the drainage lasts for weeks on end. And then there's tinnitus, and acupuncture works pretty well for some kinds of tinnitus. It's considered one of the untreatables though. So there are some kinds of tinnitus that just don't respond to acupuncture. And then what I've noticed mostly is just fatigue, and just restoring someone to just a sense of, I feel like my old self again. That seems to be what I need to do.
Yeah, so I just put in a chat, Dr. Hoyt, I think we should do a full open house just for post-COVID. I think there's even people who didn't have COVID, I think they would be interested in joining, because I think there's so many, it's just so much around us at the moment that it's very fresh. And I think we should wait for a couple of months for Ashley to kind of settle in and get comfortable. And we're probably even going to bring somebody from the GW. I'm guessing Dan, who's the current director of the post-COVID clinic.
Can I say one final thing about,
yeah, of course,
about COVID? So I've talked about the kidneys and using moxa to boost the energy of the kidneys. COVID seems to affect the kidneys in another way. I've talked about acupuncture and Chinese medicine as a medicine of correspondences. So the kidneys correspond with water, and the emotion that's related to that is fear. There seems to be, when you get COVID, there seems to be an insult to the kidneys because there's so much fear around it. And the whole thing has been the fear of dying, fear of isolation, fear of being alone, fear of the unknown. And that portion must also be addressed at the same time. And I think if you do it,
I think there's also a major societal aspect. I mean,
Yeah.
there's so much, I don't know, emotional attachment, if you will, to the COVID on both aisles politically. And I think it's been affecting all of us too, to some degree. It must be.
I think so. And I think the other thing about when you get the flu or you get sick, even a long cold, in normal times, you go back to work and there's a normalization. That's not happening here. And so the insult lasts in your body because there's no return to normalcy.
Well, thank you, Dr. Hoyt, so much. So I'm mindful of time. We have about 10 minutes left. I don't want to go over, so Dr. Rioux is just joined us, and Dr. Rioux, give us a little bit highlight of Ayurveda. I have posted our video that we recorded this Wednesday in the chat, but it's also on the Facebook, and I hope that everybody signed up, subscribe to the channel so that you can also see all the updates. But it's wonderful that you're here so that people also can ask you questions if they have them as an opportunity. So I don't know, maybe a couple of minutes just to make sure we have time for questions at the end.
Sure. No, I'd love to respond to questions because I find that keeps one from kind of going over well-trodden territory, sparks the mind to explain things in a different way. So if anybody has a question, please put it in the chat. And I promise I am never, ever bothered by people mispronouncing my name, but just for the record, it's Rioux.
Yeah, that's one thing. Like, I'm usually good with names. It's this French. It's
totally
French
fine.
names for Russian people. I don't know why, but like I always have problem with this extra letters. So maybe after a couple of years I'll master it.
Okay, no problem. I'm patient. So, okay, so Ayurvedic medicine is a wonderful comprehensive system of primary care, which is applicable across the life cycle for both acute and chronic conditions. It's particularly well suited for lifestyle related conditions. Ayurveda focuses on dietary modification, lifestyle, daily routine. Then we also have manual therapies of various kinds and detox and rejuvenation therapy. And I want to say a little bit of something about Ayurveda's approach to detoxification because it's extremely elaborate. Some people know about Panchakarma. Panchakarma refers to the 5 actions. And so when someone does Panchakarma, you can do it for 7 days, 14 days, 21 days. It's a very extensive process, which includes mono diet. So people eat khichdi, which some people may be familiar with, which is typically mung beans with spices and basmati rice. And what that does is it provides the digestive system a break. And it's very easy to digest, but also has dense nutrition. So the digestive system can then kind of reset itself. It helps. There's also usually the incorporation of ghee into the diet at that time. And ghee in Ayurveda which is clarified butter, is kind of considered a bit of a magical substance. It has some paradoxical properties that it both stokes digestive fire but is cooling. Most things that stoke digestive fire are heating, so that's kind of one of the magical properties of ghee. It's very nourishing to the digestive tract. It will oleate the digestive tract, and in doing so, both heal and move out undigested foodstuffs that are kind of stuck in the digestive tract. And yes to the person from the chat, Rioux. Yeah. And so that is done. Then also Swedana, which is a sweating therapy. And it is a steam box. So it's a wet type of sauna. And then application of oil to the forehead, which is Shirodhara. And then there's massage. And Ayurvedic massage is a little bit different in the sense that we massage from the periphery of the body to the center in order to move the doshas that have leaked out of the digestive tract back to the digestive tract for elimination. And so once all these therapies have been provided over the course of a number of days. Towards the end, there's some kind of purgative therapy that is applied. So either you can take typically triphala, a high dose of triphala, to evacuate the digestive tract, or sometimes there's a medicated enema. And traditionally in Ayurveda, if there's a lot of excess kapha dosha, there will be vamana therapy, which is self-induced vomiting. We don't do that in the United States because there's people tend to have a negative reaction to that. But I've seen it done. And if there's a lot of congestion in the lungs, it's very effective. So if there's a lot of congestion of some kind in the upper body, it's very effective for that. Or a lot of kind of mucus and kind of those kinds of toxins in the upper GI tract, in the stomach. So, so those things are applied, and there's a very elaborate theories of causality related to detoxification in Ayurveda, and even the sensory organs can become overwhelmed. So there's digestive fire in all the organs and tissues of the body, not just the GI tract, but also at a cellular level. And when the doshas are aggravated, when we can and do on a regular basis take in too much sensory stimuli, we don't have an opportunity to digest, metabolize, absorb, and eliminate properly our sensory stimuli. And in that way, the sensory organs also can become overwhelmed and become somewhat toxified. And so there are mechanisms for that. Some of them are spiritual therapies, psycho-emotional therapies. Sometimes diet will help with that. But often that's something that Ayurveda offers that isn't typical in other systems, that understanding of sensory toxicity. And sensory toxicity can lead to physiological toxicity because it becomes a drain on the metabolic system and will then cause a slowdown in other places. And the other thing is that it can inform a lot of psycho-emotional problems, that kind of sensory overwhelm and toxicity. So it's very important to address that.
Great.
Yeah.
I want you to mention, so or both of us actually, so we're doing this together. We have a student from GW, I think is a first-year medical student, who asked us for a project, and we decided to, instead of doing a formal research, what we're going to do, if there are any interested patients, we're simply going to observe our patients through the treatment with Jennifer. So if you're interested, you just need to let us know. This is not an IRB. It's not a formal research. You don't need to worry about. So if we end up publishing your case, what will happen is there's going to be no identifiable information of any kind. And it's unfortunately, I think in my experience, Ayurveda has been misunderstood a lot in America. It kind of got transformed into this, I want to say, kind of a weekend simplified, oh, here's an Ayurvedic coach who had a few hundred hours of training and they're going to fix you. And it's an extremely complex system of care. It's actually in a way probably closest to Chinese medicine system. I don't know if I'm overstepping my knowledge here, but I'm guessing that both systems have kind of in parallel developed in different parts of the world. And so they're very comprehensive. And I'm super excited to have Jennifer. I will at some point start saying Dr. Rioux. Is that right? Is it better?
Rioux.
All right, I'll get there. Anyway, so point being is, I think that it's just wonderful that you joined us, because we can have a full scope of this practice with our patients and not just superficial.
Yes.
So we are right on time. I promised everybody we'll keep it tight. So we'll honor that. There is a question, I think.
Misha, can I really quick just make the
Sure.
the point that anyone who signs up to work with this medical students project receives a discount on their Ayurvedic care. You just sign up for 6 complete appointments. That's kind of a that's what they need for their project, and then there's, I think it's a 10% discount or something like that. So just to put that out there.
And there's a question, so let's answer that question before I say a few closing words.
How does the fasting method relate to type 2 diabetes? So it depends on the person. The only thing that is always true in Ayurveda is it depends. right? We have to know the constitution and imbalance profile of the person. So a variety of different types of constitutions can have manifest type 2 diabetes. Typically, it's a kapha type condition. So it can be appropriate for type 2 diabetes, but it really, I don't want to say anything that's too standardized, because Ayurveda is very much an individualized system of medicine. So.
Great. And Lisa's asking a question. I don't think it's for you, Jennifer. I'm not sure if it's for Tiffany either, and I have no idea how to answer that myself. So I don't know. Anybody can answer Lisa's questions. Thoughts on microclotting in microclotting, okay, in patients and the Germany treatment of, I don't know what the treatment is. Is this, if it's an antrophosophical treatment, I will need to look it up. I don't know what apheresis is, but microclotting is definitely a huge part of the COVID. And I think that's a unique part. And that's what dramatically separates it from the flu, even severe flu. We don't really see that. And I think that's part of some of the list of complications. And I don't know if I told everybody my personal part, but when I got COVID, I definitely had that because I had an acute headache and a kind of partial paralysis on the side of the body for a period of time. And I actually took a lot of blood thinners right away when that started happening at home. So just saying. There's more questions coming. So I think we're going to have to answer them. And even if it means we'll stay for a couple more minutes, I think it's okay.
So I'll just quickly say, the person who's asking about in India, there's hands-on work with two therapists, sometimes with two therapists. So what you're referring to is Panchakarma. I mean, you can do a la carte manual therapies in Ayurveda. So for instance, somebody that has migraines or anxiety or insomnia would benefit from Shirodhara. Anybody can benefit from Ayurvedic massage. There's Marma therapy, there's acupressure therapy, which we typically do with essential oils. So a variety of manual therapies that can be beneficial a la carte, depending on the person's condition. But what you're suggesting with two therapists, typically two therapists, is Ayurvedic massage. And the reason is that each one attends to a side of the body and they move in unison. And that's a typical part of Panchakarma. Right now at the center, we're not offering Panchakarma. I haven't really talked with Dr. Kogan about that, but that's something we can discuss, for the future. It is intensive therapy. But yes, I've always just done most of the Panchakarma therapies myself, and then I bring in a second massage therapist to do the two-person massage. Yeah.
If there is a strong need, we'll make it happen somehow. No worries. Thanks, Lisa. I see it's a dialysis. I wouldn't recommend that because there's so many much safer methods for microclotting. The dialysis is extremely risky because when you put the catheter to dialyze the blood in and out, you're causing a pretty massive shift in the homeostasis of the blood in what's called the hemodynamics. So dialysis is a tricky business. I would never recommend it if you have, like, for example, I took something called nattokinase, which is an extract from soy. And it's a very effective medical treatment for blood thinning. So there are other methods that I think would probably be safer than dialysis. So, Tiffany, I don't know. Okay, so we'll address that. How about we bring that whole point, apheresis, and I'm gonna have to learn what that is because it sounds like it's a bit more complex than just dialysis. So we'll come back to that. So, I think we covered everything. I'm sorry, we're a little bit over time. I had a plan at the end, if time left, to discuss other research projects that Center is doing. I'm just going to list them, but we're not going to have time to talk about them or have questions answered. So we have a mercury study going. So we're looking at impact of metal toxicity, mercury toxicity on a breast cancer. We have the Ayurvedic trial, and we also have two other trials. We have two trials around memory impairment. So one, we're just looking at our outcomes of our RECODE program. RECODE is a reversal of cognitive decline. That's a Dale Bredeson's work. And we also have a light and sound therapy. Light and sound therapy, we actually can still recruit the patients for that. It's a light therapy actually has been shown recently to support the Alzheimer's or improve Alzheimer's outcomes. So we're looking into that, but we're trying to wrap up that trial. We're actually already at our target. We just have 3 more patients finish the treatment, and we're probably going to publish that in 6 months. So thank you so much, everybody, for joining. It's pleasure. Again, we will do this on a regular basis. Sounds like there's enough interest. Hope we'll see you all back. Do subscribe to our Facebook channel and our YouTube channel. Have a wonderful weekend. It's absolutely gorgeous out there. And thank you specifically for all practitioners who came. Tiffany, Cynthia, Nina, Angela, and I'm not going to say Dr. R. I'm just going to say Dr. R. Oh, I can do that. Okay. And Dr. R. So see you guys next time. Thank you very much. Bye, everybody.
Bye, everyone. Be well.